How many times a day does a patient sit in your waiting room? In this chair, how many patients a week, a month, a year? Do you know what each of these patients is thinking while they're sitting, waiting, when they leave? What do they tell their family and friends? What are people saying about your practice?
If they're not happy, they're going to tell everybody they know.
Our goal is to help you capture feedback from your patients in a valid way so you can use that information to promote why you're better and what you're doing to address any shortcomings that may exist in your practice. It's critical for a medical practice to measure patient satisfaction to better understand what their patients think about the service they're receiving.
A customer who has a good experience will tell an average of 5 other people. But what if a patient doesn't have the best experience? Recognizing and resolving a patient complaint quickly is extremely important in retaining patients.
You have a very powerful tool to be able to show people where things need to be improved, and then when you make changes, whether those changes are effective. We noticed immediate results when we started surveying patients. We really had no idea what level of customer service we were providing. Our patients were able to give us input on specific areas like cleanliness and wait times and the quality of services that they were receiving from physicians.
It's a great tool because it gives me objective data. In general, physicians are very smart people and they really like to make data-driven decisions. When you present them with data about how they're perceived and how they're perceived compared to standards of the industry that the Press Ganey data gives us, they're more willing to make changes.
We were able to make changes to the scheduling department to be able to handle the calls more quickly and efficiently and be able to get patients in a quicker time frame. Certainly retaining patients is a much more cost-effective and efficient than it is having to go out and find new patients.
It's very difficult to bring on new patients, and once you lose patients, they generally will tell other people about their dissatisfaction and why they left. If they're not happy, they're going to tell everybody they know.
You know, in business, in order to make decisions, in order to make smart decisions, you have to have data.
Of those patients who do complain, 50 to 70% will do business again if their complaint is resolved, and 95% will return if their issue is resolved quickly. Compared to physicians with top patient satisfaction survey ratings, those in the bottom third of the Press Ganey database were 110% more likely to have malpractice lawsuits brought against them.
With the growth of malpractice premiums and malpractice claims, it's best to understand what patients think.
When the patient feels that the physician cares about them as an individual, they form that bond. And when there's that strong patient-physician relationship, the possibility of having a malpractice suit brought is extremely low.
Finding and correcting the weak points in your practice is one benefit of electronic surveys, but positive reinforcement can go a long way, and finding the stars amongst your employees and reciprocating and recognizing their achievements can really move a practice forward.
We do have the results incorporated into the bonus plans we have for the staff. We would certainly find other ways to reward the employees as well, you know, perhaps with a monetary reward or a gift or some kind of recognition, you know, for providing that level of service. And we get a lot more positive feedback than anything else, and so that's something that we're able to acknowledge and share with the employees and physicians in a number of different ways, and I think that contributes to having a positive environment.
A practice can also use the information for marketing to help differentiate and promote what they're doing really well. We have clients who've used it in advertising, in signs in their waiting room. They've taken out, billboards, and they promote their commitment to patient satisfaction.